Hello everyone, Dr. Tina Mims here. It's been a while since I have done a vlog, and that's because I've been really busy with my residency program. But I wanted to talk to you guys today about the recent happenings here in the Bahamas. So we're talking about recent increases in the COVID-19 cases. We're talking about the locations. We're even talking about tourists, visitors coming to our shores, and an incident yesterday where I am sure everyone found that really interesting to see that we had some tourists here without the proper testing. So I wanted to come on a little bit earlier, but I wanted to listen to the press conference. A lot of the physicians here actually get all the information that we do have from listening to the press conferences as far as dissemination of the information is concerned. So sometimes we hear everything the same time you hear everything. So basically where we're at now, 116 cases. We're having more cases show up in Grand Bahama than in Nassau. We have one case here in New Providence, and the remaining cases, I think over the past week, have been 8 new cases in Grand Bahama, all of which are doing contact tracing for and everything. What I wanted to address is travel. I know I would have mentioned a lot of things before in previous posts with regards to traveling and what we can expect coming into the country from others. The big scary thing that everybody is concerned about is about visitors bringing COVID here. And naturally so, we should be concerned, right? But what if our biggest, or one of our biggest problems, or the biggest enemy, is really ourselves? What we're seeing now in Grand Bahama is that Bahamians are leaving. The borders are open. Why shouldn't they leave, right? So they're leaving to visit. I don't know if they're going shopping, visiting family and friends, whatnot, and they're traveling to these hotspots in the U.S. and they're coming back. Some of them, not all, but they're coming back and they're bringing COVID-19 with them. Unknowingly, of course. Nobody's going to intentionally bring COVID back, right? But they're coming back with the coronavirus and they're showing symptoms, okay? So while everyone was in up in atoms, including myself, about, hey, let's make sure these borders are protected, make sure these tourists get their tests, make sure this is done, make sure that is done, we also have to take responsibility ourselves, because we are right now proving to be the persons to bring COVID-19 back to our country, right? Isn't that strange? We didn't consider that we could bring it back. Yes, we can. So we can be vectors. We can bring transmissible infections back to affect our families and our friends. It's not just isolation, well, really quarantining or lockdown. Everyone's afraid of lockdown, yes, because it restricts our movement and we feel like it takes away our freedom and whatnot. So nobody wants another lockdown. But people are still traveling, and they're coming back with the virus. Now, how can we address it? How can we stop that? They're saying that within 10 days you have to have a negative PCR test before returning to our own country, which I think is right. I think it's only correct to do so. Whereas they were saying that you needed 3 days to be gone for 3 days, or a minimum of 3 days in order to need the testing. Now everybody's going to need the testing, whether you went for 24 hours, 48 hours, whatnot. You're going to need to have a PCR COVID-19 test. And I'm going to come back to PCR. In a previous post, I explained the difference between PCR and PCR molecular testing and antibody testing, because we're going to go and visit what those tourists did in a bit, what the tourists did yesterday in a bit on Cabbage Beach. But PCR testing is molecular testing. It's genetic testing on the smallest level possible to properly and adequately identify the COVID-19 or the coronavirus. Okay, so if your PCR test tells you that you do not have coronavirus and it was done properly, the technique was done properly, then you don't have it. But there are other tests that some people are trying to pass off as the appropriate test that's needed to come in the country, and those tests are the antibody tests. What are antibody tests, right? I'll explain it again. The antibody test just checks your blood to see if you have mounted an immune response to the coronavirus. Meaning, if somebody has caught the coronavirus and they now are infected and their body is fighting it off, it would create antibodies, right? Things, little powerhouses in the body that fight infection. So if we can identify those, then we could say, oh, they're fighting the infection, so obviously the infection is there, right? Here's the problem. And there's a lot of research still going on about it because it's fairly new and we're learning as we go along. And so that's why research is important. But what we found is that not everybody has these antibodies. Not everybody mounts the immune response. It's too irregular, up and down. The numbers are up and down. You can't really quantify it to say, hey, everybody who takes this test and actually says that they're negative is actually really negative, because somebody could have coronavirus and based on their immune system, their own personal immunity, based on on their genetics, based on whether or not they have an autoimmune disease or something that makes them immunodeficient, or basically doesn't have a good immune system. Basically what could happen is somebody like that can take an antibody test, COVID-19 antibody test, and test negative, but they can actually have it. That's why nobody is relying on antibody tests, because basically you could have a lot of false positive, you could have a lot of false negative, people who actually have the virus but still test negative for it. And that doesn't make any sense, which is why we're not employing that method. We're not allowing tourists to come into the country using the antibody test, because it's basically no good. You can't guarantee that the person who tests negative is actually negative. So that's why we're using the PCR test. So what is the PCR test? I explained it's the molecular testing. It's the one where they have to introduce that really long swab, looks like a Q-tip, of both your nostrils. That is the one that you need. That is the one you will need to take. If you travel to the States, you will need to take that one in order to come back home. Okay? Now, if I were your doctor, I can't tell my patients not to travel. Listen, no one can infringe upon your God-given right to do what you want to do or what you need to do. We can't tell you what to do. We give advice. But if I were your family member, if I were your friend, and considering I'm also a doctor, I tell you not to go right now because of the safety issue. You'd have to be very, very, very careful on your P's and Q's going to these hot spots anywhere in Florida, California, New York, places like that. There's still hot spots, okay? And it's just spreading. The U.S. is just going through its first wave, and they're battling with it. And so you're going over there. You don't know who can have what, and then you're coming back home. Now, what I also wanted to talk to you guys about was the tourist situation yesterday. Tourists on the beach, on Cabbage Beach, jumping the fence and going on the beach. Now, I understand that we have some amazing water. We have amazing beaches, okay? Trust me, it hurt me that I didn't get a chance to go on the beach on the holiday, and it was so hot this weekend. But listen, Bahamians are well acquainted with the law regarding the beaches right now, and so none of us want the smoke of that fine or jail. So I'm pretty sure that those tourists knew exactly what they were doing or what they were up against, because they were told not to. The beaches were locked down, and yet they did it. To add insult to injury, guys, they said that they didn't have the PCR test. If you listen closely, because I heard the newscast, they didn't have the correct testing. So how did they even get here? How did they get through? They were supposed to be sent back. Who let them through? That is a big issue. That is a big issue, because we cannot let people through with PCR testing because it's inaccurate. It's just not reliable. So if you're letting you're letting tourists in the country, we're not telling them not to come. We want them to come, but we're not letting you come at the expense or to the jeopardy of the Bahamian people. This thing goes with sense, guys. And so my question is, 1, who did it? Will they be held responsible? 2, what happened to the tourists? Did they incur any fines? Jail time? I don't want them to go to jail. I don't really want anybody to go to jail for going on the beach, okay? But did they incur any repercussions whatsoever? Because I'm sure if it was me or you, or the young boy who was there selling coconut on the side of the road, somebody would have been in jail or carried to the court. So let's be real about this. We cannot allow people to step on our shores and to step on our laws. We are not slaves. We are not there for their amusement. And these laws are here to keep Bahamians safe. Them too, but Bahamians first. Let's be real about this, okay? So I hope the powers that be, the competent authority, addresses that situation, because it needs not happen again. And no one needs to come to this country without the adequate testing. Nobody needs to pass our borders. They said that they were going to be sent back. Why weren't they sent back? That's a really important question, right? So again, Bahamians, be safe. Exercise good judgment. I can't tell you not to travel right now. But I'm not traveling right now. There's no way you can get me to travel right now, knowing what's happening there and knowing that when you come back, you can bring it back to your family and your friends. Okay, we're still in COVID. I mean, this thing is just ramping up again. Okay, be smart, be safe, take care of yourself, stay sanitized and moisturized. I love you guys. See you later. If you have any questions, inbox me. All right, you guys have a great one. Bye-bye.